Cedar Creek Medical smells like antiseptic and something underneath it, the faint copper of old blood underneath the bleach. Katie Rodriguez knows this smell the way some people know their mother's perfume. She's been walking these corridors for 3 years, and in 3 years, you learn that fluorescent hospitals all smell the same whether you're in Atlanta or Kandahar. She keeps her head down during grand rounds. Always. The surgical team spreads through the ward like a flock of egrets, white coats and clipboards, and the weight of certainty that comes from never being questioned. Dr. Mercer leads them, his voice pitched to echo off the tile in a way that makes him sound larger than he actually is. Katie delivers charts without making eye contact. This is not submission. This is tactical. There's a difference, though nobody here would understand that. The cardboard box under her locker at Cedar Creek contains exactly 3 things. A cracked coffee mug from a cafe in Kabul that closed in 2019. A succulent dying from neglect, she keeps forgetting to water it, and there's something almost honest about letting it wither. And beneath those, a photograph and a folded flag the color of blood and ash. The photograph shows her son standing beside a young Special Forces officer in desert camouflage, both of them squinting into sun bright enough to burn. The officer's name was Marcus Jr. The flag came back in a box 3 years ago, and Katie has not opened any of the other items that arrived with it. She touches the flag sometimes when nobody's watching. Never in the break room, never where someone might see her hands shake. Captain Katie Rodriguez doesn't shake. Not here. Not where people remember her as just another RN who got her degree through the military and carried a limp from some unspecified injury that nobody asks about because it's considered rude to ask about disabilities in a hospital where everyone is trained to ignore them. Her hands are steady when she starts fours. Steady when she charts vitals. Steady when she reads the file on the 12-year-old in room 347 and sees the name, Tyler Hayes. The name hits like a fist to the sternum, though her face doesn't change. Her breathing doesn't change. She reads the chart the way she was trained to read maps under fire, absorbing every detail, processing, moving forward without hesitation. Tyler Hayes. Paralyzed from the 6 spinal injury. Training accident. Non-responsive to conservative management. The surgical history is thick, 2 spinal fusions, decompression, laminectomy. The prognosis is thinner, palliative care recommended. 5 specialists have signed off on that recommendation. Dr. Feldman from neurosurgery. Dr. Chen from orthopedics. Dr. Patel from rehabilitation medicine. 2 others whose signatures Katie doesn't recognize. All 5 have written the same words in different ways, no further intervention recommended. Comfort care only. The boy is 12 years old. The door to room 347 is closed. Katie has not opened it yet. She will, but not now. Not while her mind is still assembling information the way she used to assemble breaching charges, piece by piece, accounting for every variable, understanding what comes next. The intercom crackles. Dr. Mercer's voice, smooth and commanding, grand rounds beginning in 10 minutes at the nursing station. All nursing staff, please attend. It's not a request. Nobody phrases it that way unless it's not a request. Katie shelves the chart and moves toward the nursing station with the same measured pace she uses for everything. There's no rushing. There's no anticipating. There's only the next step, and then the next. She learned this in the Hindu Kush, in the field hospital they'd built under fire in Sanjan Valley, where anticipation got people killed. In the Logar province, at FOB Shank, where she'd held a perimeter for 14 hours while rounds came through the walls. 217 people had been in that hospital. 212 had walked out alive. The rest were already gone before she ever met them. That was Captain Katie Rodriguez then. That was Reaper 6. She is none of those things now. The surgical team gathers like they always do, Mercer at the center, residents arranged by hierarchy. Katie stands at the periphery, hands clasped in front of her, the way she's learned to stand. Invisible. Unquestionable. Present but not existing in any way that matters to them. The morning sun comes through the windows at an angle that makes everything look like it's underwater. Mercer begins with a patient from orthopedics, a rotator cuff repair, unremarkable. His words are precise and somewhat contemptuous, the way he speaks about bodies as if they're machines he's read the manual for once. He moves through the cases, resident trailing behind him scribbling notes they'll memorize and then forget. Katie watches. This is what watching looks like. Not staring. Just the kind of attention that registers everything and displays nothing. Room 347, Mercer announces, pulling up the chart on the screen beside him. Hayes. 12-year-old male. Spinal cord injury, T6 level, traumatic. Training accident. He lets that phrase sit for a moment. The consensus from our specialists is palliative care only. The damage is irreversible. A resident leans forward. Young. Still has the kind of enthusiasm that hasn't been beaten out of him yet. What about experimental treatments? There are some new protocols for pediatric spinal trauma. Mercer's smile is the kind that teaches lessons. Consensus care is evidence-based care. The evidence tells us this child's prognosis is fixed. We can either prolong his suffering through invasive intervention, or we can focus on comfort. The choice is clear. Katie's jaw doesn't tighten. Her breathing doesn't change. Her hands stay clasped exactly as they were before. But something shifts inside her, something that's been quiet for 3 years, something that remembers what it means to watch people die when they didn't have to. The family has been informed of our recommendations, Mercer continues. The father, General Marcus Hayes, has indicated he understands the scope of the injury. He says the rank like it matters. Like a general's rank changes biology. Grand rounds continues. Room 348. But Katie's hearing isn't following Mercer anymore. It's following the sound of the ventilator in room 347, 3 rooms down the corridor. She can hear it from here, the steady mechanical wheeze of life being delivered by plastic and electricity. She can hear something else underneath it. She can hear the sound of someone holding their breath. That was what it sounded like in the field hospital too. The relatives. The ones who couldn't be in the room because there wasn't space, because the operating area was the size of a closet, because there were too many of them and only her hands. They held their breath in the hallway. They waited for the next piece of information. They tried not to believe that the next piece of information would be bad. General Marcus Hayes has not believed it yet. Katie can hear it in that held breath. He does not believe his son is gone. Mercer finishes his rounds without looking at her again. He doesn't need to. She understands her place. She understands what the chart means when 5 specialists write the same sentence 5 different ways. She understands what palliative care means in a hospital where everything is already decided. But there's something Mercer doesn't understand. Something none of them understand, because they've never held a perimeter under fire. They've never had to keep people alive with improvised equipment and the kind of problem-solving that comes from knowing you're the only medical provider for 200 miles. They've never learned what Captain Katie Rodriguez learned in San Juan Valley, that consensus isn't the same as truth, and the people who give up are usually the people who've never had to keep fighting when giving up would be easier. The file on room 347 says Tyler Hayes is paralyzed. The file says there's nothing that can be done. The file says 5 doctors agree. Katie has spent enough time in hospitals to know that files can be wrong. She's spent enough time in the field to know that consensus often means someone with authority stopped looking hard enough. She retrieves the chart again when Mercer's team disperses. She finds a quiet corner. The break room is too social. The supply closet is where people look for her when they want to dismiss her, and she reads the file the way she read tactical reports. Every detail. Every image. Every lab value. The ERT scans show complete transection at T6. The imaging is clear. The damage, according to 5 specialists and the weight of medical consensus, is irreversible. But Katie's eyes land on something the specialists didn't highlight. The most recent labs. Drawn 4 days ago. Spinal fluid markers that are unusual. Not necessarily indicative of anything, but unusual enough to suggest that something, somewhere in that spinal cord, is still trying to heal. Still trying to work. Still sending signals up and down neural pathways that should be completely dead. It's probably nothing. The door to room 347 is closed. Through the small window, Katie can see a shape in the bed, small, still, the kind of stillness that belongs to children and people who've learned not to hope. She can see monitors. She can see a ventilator. She can see a man sitting beside the bed, a man whose pairing is military despite the civilian clothes. Whose hands are clasped too tight. Whose jaw is locked the way people lock it when they're holding onto something and afraid it's about to break. 4-star General Marcus Hayes does not know that his son is still fighting. 4-star General Marcus Hayes does not know that 5 doctors have given up, and that in Katie's experience, when 5 doctors give up, that's usually the moment when the real work begins. She closes the file. She does not go into room 347. Not yet. Not while Mercer still controls this ward, still has the authority that comes from certainty. But her hands, when she's alone in the break room, finally shake a little bit when she touches the folded flag underneath her locker. The glass-walled conference room hums with the white noise of 30 people pretending to listen. Neurosurgeons in starched coats. Residents with coffee cups balanced on their laps. 2 medical students standing because there aren't enough chairs. This is Grand Rounds at Cedar Creek Medical, the weekly performance where physicians present cases and junior staff sit quiet, notebooks open, pens ready to write down gospel. Katie stands against the back wall, her badge clipped to her scrub pocket, laminated and official and utterly worthless in this room. She has learned to make herself small here. Not invisible, small people get noticed. Small means harmless. Small means you don't threaten the men in the front row who've spent 15 years earning the right to speak without being questioned. Dr. Mercer is presenting the Hayes case. Not by that name, of course. Case number 2847. Male pediatric patient. 12 years old. Spinal cord injury, complete T for transaction, prognosis, terminal decline. The chart projects onto the screen behind him in clinical detail. Katie's nursing notes are there too, line by line, 5 days of her observations documented with the precision she learned in the field, because field medicine teaches you that data is survival. That details saved lives. Here, Mercer says, tapping the screen with his laser pointer, we have an example of scope creep I'd like to discuss. The pointer circles her notes on decreased respiratory effort. Subcutaneous emphysema developing in the left upper quadrant. Temperature trending upward. Nurse Rodriguez has documented observations that suggest, he pauses, letting his eyes find her in the back of the room, a differential diagnosis. Which territory do we reserve for physicians? The silence is immediate. Calculated. A trap disguised as a teaching moment. Diagnosis, someone murmurs from the front row. Correct. Mercer smiles. The smile of a man who's already won. So let's examine the premise here. A registered nurse with no medical degree attempting to interpret clinical findings as though she possessed the training, the education, and the legal authority to do so. He turns to face her fully. Nurse Rodriguez, remind us of your educational background. For the resident's benefit. Katie's jaw tightens. Just for a moment. Just enough for the muscle to clench, for anyone watching closely to see the restraint required to keep her expression flat. BSN from Emory. Her voice is level. Deferential. Critical care certification. Trauma certification. No medical degree, Mercer confirms, nodding slowly like he's just proven a theorem. No diagnostic training. And yet, he gestures to her notes on the screen. Here we have clinical interpretations that border on the presumptive. He holds her gaze. Let's keep our documentation within our competence, shall we? I think that's a teaching point for everyone in this room. Write down the scope of practice. Write it down and remember it. The residents do. Katie watches their pens move. Watches the medical students exchange glances. Watches the attending physician next to Mercer smile into his coffee cup. The presentation continues for another 5 minutes. Her notes are discussed 3 more times, each reference positioned as an example of overreach. By the time Mercer finishes and the conference room empties, the narrative is set in concrete. The rumors will follow her like exhaust. Nurse Rodriguez overstepped. Nurse Rodriguez thinks she's a doctor. Nurse Rodriguez doesn't know her place. She stays until everyone leaves, until the room is empty except for the hum of fluorescent lights and the faint smell of antiseptic someone mopped into the corners this morning. Then she walks back to the nursing station and documents that she was in grand rounds, that her notes were discussed, that she will continue to monitor vitals every 2 hours as ordered. 2 hours later, the vending machine on the 3rd floor jams on her dollar bill. It's the machine she's used every day for 6 months, the one that almost always takes the first bill but gives you the snack. Today it swallows the dollar and offers nothing. Katie shakes it once, twice, a mechanical rattle that echoes down the empty hallway. The elevator dings 3 floors up. Someone's coming. Dr. Mercer emerges from around the corner with 3 residents trailing behind him like pilot fish around a shark. He sees her with her hand on the vending machine and slows his pace. His expression shifts into something soft and predatory. Having trouble with complex machinery, Katie? He moves past her, stops, turns back. Maybe you should stick to bedpans. The residents snicker. It's the kind of laugh that happens when someone important has given permission for cruelty. When mockery becomes acceptable because it comes from the top. Katie retrieves her dollar, the machine releases it as he speaks, as if timed for maximum humiliation, and slides it back into her pocket. Your nursing certificate program, Mercer continues, addressing his residents but keeping his eyes on her. Did they cover basic problem solving? Or did you take that track before you finished high school? He laughs. I'm asking because some of those programs don't require a traditional diploma. I've always wondered. The silence that follows is the kind that precedes something irreversible. Katie turns to face him fully. Her hands are steady. Her jaw is set. Her eyes are a color between gray and stone, the color of something that has already decided what it will do and is simply waiting for the moment to do it. When she speaks, her voice has dropped an octave. No apology. No please. No filler. Your ego writes checks your skills can't cash, and one day a patient will pay for it. She turns and walks away before he can respond. Before he can escalate. Before the residents can process what just happened. The hallway is silent except for the sound of her shoes on tile, a steady rhythm that doesn't quicken, doesn't hesitate, doesn't acknowledge that she's just crossed a line from deferential to dangerous. That afternoon, she delivers chart corrections to his office. The corridor outside Mercer's suite smells like old carpet and the faint chemical burn of desk furniture polish. Katie holds the chart in her hands, Tyler Hayes' updated vitals, her notes from the morning assessment, objective data that speaks for itself. The boy's oxygen saturation is dropping. Not catastrophically. Not yet. But the trend is wrong. His respiratory rate has increased from 16 breaths per minute to 22. His temperature has crept up to 101 for Fahrenheit. These are data points. These are information. Dr. Mercer doesn't look up when she enters. He's at his desk, computer screen glowing in the dimness of a room that has no windows, no sunlight, nothing but the fluorescent hum and the reflection of his own importance in the polished surface of his desk. I don't recall asking for your input, he says before she's fully inside the door. The patient's oxygen saturation is dropping. Katie keeps her voice level, professional, stripped of everything except the facts. Respiratory rate increased from 16 to 22. Trending toward. Get out. He stands as he says it. His chair rolls backward on its wheels with a soft squeak. His voice rises, not shouting, not yet, but the kind of rising that precedes shouting. The kind that announces that everything that follows will be measured against his anger and found wanting. If you ever question my orders again, I will call security and have you escorted from this building. Do you understand me? He leans forward, hands flat on his desk, shoulders wide and imposing, the physical language of dominance. I will have you removed. I will file a complaint with the state board. I will contact your nursing school. And I will make sure that every physician in this hospital knows that you cannot be trusted to stay in your lane. Do you understand? Or do I need to use smaller words? Katie holds his gaze. 3 seconds pass. Then 4. Then 5. The silence stretches like something alive. Her eyes don't waver. Her hands don't shake. Her breathing doesn't accelerate. There is no visible sign that anything he's said has touched her at all. Then she turns and leaves. Outside his office, a nursing assistant named Marcus, someone Katie thought was friendly, someone she'd helped during a chaotic shift 3 weeks ago, whispers to another aide. I heard she barely passed her boards. Took them 3 times. It's not true. Katie's NCLEX score sits in an archive somewhere, a 97th percentile result that she earned in a single attempt, the kind of score that comes from someone who understands the difference between what you're supposed to do and what actually keeps people alive. But the truth doesn't matter anymore. The narrative matters. By the end of shift, 4 people have mentioned it. By tomorrow, 8 will have heard the rumor. By Friday, it will be institutional knowledge. Nurse Rodriguez didn't even pass her licensing exam on the first try. Nurse Rodriguez barely made it through school. Nurse Rodriguez is barely qualified to work here at all. But that wasn't the worst part. That evening, from his home office in a neighborhood where his neighbors all drive European sedans and the houses have circular driveways, Dr. Mercer makes 4 phone calls. The first is to Gerald Whitmore, the board chairman, a man he golfs with monthly at the Piedmont Driving Club. Mercer expresses concerns about patient safety. Mentions a nurse showing signs of instability. Questions whether her credentials have been properly verified. Suggests a conversation might be warranted. The second call goes to Emory's nursing school registrar, requesting verification of one Katie Rodriguez's degree completion and transcript history. For quality assurance purposes, he says. For the hospital's peer review process. The third call is to a contact at the state medical board, someone who owes Mercer a favor from a malpractice case he once consulted on. He asks about formal complaint procedures. About nurses practicing outside their scope. About how long investigations typically take. The fourth call is to a private investigator named Douglas France, someone Mercer has used before for background checks and malpractice defense preparation. He requests a full background check on one captain, one nurse, Katie Rodriguez. Everything in the past 10 years. Employment history. Any military background. Any red flags. Any connections to high-level individuals. France agrees to expedite. By the next morning, 2 members of the hospital ethics committee stop by the nursing station. They ask Katie to document her decision-making process on 3 recent cases. Present it as routine quality improvement. Continuous professional development. Nothing to worry about. It's presented as routine. It isn't. 10 o'clock at night. Cedar Creek Medical, 3rd floor, pediatric intensive care. The monitors hum their monotonous rhythm, a lullaby for the dying. Katie stands at the medication cart outside room 347, Tyler Hayes' chart in her hands. The numbers on the page are screaming, but nobody's listening yet. She's read this file 17 times. A 12-year-old boy, paralyzed from a spinal cord injury sustained during a classified operation in the Hindu Kush that officially never happened. His father is a 4-star general who walks the halls with a jaw clenched so tight it could cut glass. His mother hasn't left the cafeteria in 4 days. His younger sister sits in the waiting room every afternoon at 3 o'clock until visiting hours end at 5, then leaves and comes back at 3 the next day. Routine as a penance. Dr. Mercer's handwritten orders are on the 3rd page. Comfort care only. Palliative measures. No escalation of treatment. Do not intubate. Do not intervene. Let the boy say goodbye. 5 specialists had already examined Tyler before Katie ever pulled his file. A neurologist from Emory had seen him on day 2. A pulmonologist who'd worked critical care for 23 years had reviewed the imaging. 2 intensivists from the university system had consulted. An anesthesiologist with credentials that covered an entire wall had rendered his opinion. All 5 concluded the same thing: the paralysis is irreversible. The respiratory decline is inevitable. The kindest thing is to let nature take its course. Katie had watched Mercer present the case during grand rounds. His voice had carried the smooth certainty of someone who'd never been wrong, or at least never admitted it. He'd used Tyler's file as a teaching moment for the residents, a lesson in knowing when to step back, when to stop fighting, when to accept the limits of medicine. He'd called it compassion. Katie had heard it as surrender. She pulls up the latest vitals on the monitor. Oxygen saturation, 89%. It was 94% at 6 p.m. The respiratory rate is climbing. 18 breaths per minute. 20. The subtle creep upward that most people miss until it's too late. Katie's hands have felt this rhythm before. In the Hindu Kush, in a field hospital that took fire at 0400 hours, in a makeshift MASH tent where she'd held a tourniquet on a soldier's leg for 14 hours while rounds came through the canvas like angry hornets. Pain is information. Vital signs are a language. And this boy is speaking loud and clear. She steps into room 347. The lights are dimmed. Tyler lies motionless on the bed, his small chest rising and falling beneath the hospital gown. His lost weight, children do that when they can't move, when the gravity of despair presses them down like a physical thing. His eyes are still bright, though. Still present. Still fighting. The monitor shows it plainly. Oxygen saturation dropping. Respiratory rate accelerating. And there, subcutaneous emphysema spreading across the left side of his neck like ink in water. Air where it shouldn't be. Air escaping from the lung, collecting in the tissue spaces, compressing the chest cavity from the inside. The classic presentation of tension pneumothorax. Fixable. Reversible. Fatal in the next 30 minutes if untouched. Katie pages the attending physician. The call goes through to the central line. She waits. 30 seconds. 60. The monitor beeps. Oxygen is now at 87%. Come on. Pick up. The resident answers. Not the attending. One of Mercer's disciples, a third year who'd been in the room during the humiliation ritual in the break room, who'd smirked when Mercer questioned whether Katie had even finished high school. His voice comes through the phone like ice water. Dr. Mercer's orders are clear, he says before Katie has even finished speaking. The patient is DNR adjacent. The family has been counseled on prognosis. 5 different specialists have reviewed this case. There's nothing to be done. Stop bothering the attendings. The line goes dead. Katie holds the phone in her hand for exactly 3 seconds. Then she sets it down on the medication cart with the kind of careful precision that comes from years of doing dangerous things in dangerous places. Her heart rate hasn't accelerated. Her hands aren't shaking. The trembling isn't fear. It's restraint. She knows exactly what she's about to do. She knows exactly what it will cost. Dr. Mercer has already positioned his pieces on the board like a chess grandmaster who'd been playing this game for 20 years. The ethics committee review triggered the moment she'd questioned his orders about the neurological assessment. The background check he'd initiated through his contacts at the hospital administration. The whisper campaign, quiet conversations with other physicians, suggestions that Katie was the type to overstep, to think she knew better than doctors, to be a risk to patient safety. By tomorrow morning, when Mercer learns she's acted without his explicit authorization, his entire network will be ready to move. The board will have been primed. The security cameras will be conveniently reviewed. The narrative will be written before she even has a chance to defend herself. But Tyler Hayes will be breathing. Katie walks to the supply room. It's empty at 10:15 p.m. on a Tuesday night. The fluorescent lights buzz overhead like insects trapped in a fluorescent cage. She finds the needle, a 14-gauge angiocath, sterile, ready, the kind of needle that would have been standard equipment in every field hospital she'd ever worked. She grabs the chlorhexidine swabs, the gauze, the tape. Her hands move with the mechanical precision of muscle memory. 14 years since she'd been active duty. 14 years of living as someone else. But some things don't fade. Some things live in your hands forever. She returns to room 347. Tyler's oxygen is at 84% now. The monitor shows a heart rate of 142. His little chest is working harder with every breath, his body trying desperately to pull oxygen from air that can't reach his lungs because of the air that shouldn't be there. Katie approaches the bed slowly. She's careful to move like the nurse he knows, the quiet woman who's been checking his vitals, adjusting his pillows, bringing him ice chips when he asks. Not like the soldier she actually is. The distinction matters in this room, in this moment. She places her hand on his shoulder. His skin is cool. Peripheral shut down. The body is beginning its retreat. Tyler, she says quietly. I need you to listen to me. His eyes find hers. There's recognition there. More than recognition. There's understanding. This child has had 12 years of medical intervention. He knows what vital signs mean. He knows when something is wrong. I'm going to fix this, Katie continues. It's going to hurt. Not for long, but it will hurt. I need you to stay still and trust me. Can you do that? He nods once. Katie doesn't tell him she's violating Dr. Mercer's orders. Doesn't explain that this intervention will likely end her career at Cedar Creek Medical. Doesn't mention that the attending physicians and the administration are already positioned to move against her. Children don't need to carry adult burdens. They need to know that someone competent is in control. She locates the second intercostal space, midclavicular line. The classic anatomical landmark for needle decompression. She cleans the skin with the chlorhexidine swab, watches it dry. The moment stretches, not long, just long enough to notice. A nurse acting without physician authorization. A soldier making a command decision. A captain choosing between orders and the child in front of her. She advances the needle. There's resistance, then release, the hiss of pressurized air escaping from the chest cavity. The sound is unmistakable. Katie's heard it before in a canvas tent at 6,000 feet elevation, in the dark, while rounds pinged off metal medical equipment. The sound of a life being saved. Tyler's oxygen saturation jumps. 87, 89. 92, the respiratory rate begins to normalize. 22 breaths per minute. 20, 18. The monitor settles into something resembling stability. Katie secures the catheter with tape, then steps back. The boy's eyes are still on hers. There's no gratitude there, just the profound relief of someone who can breathe again. Who can feel the air moving through his lungs without fighting for it. I'm going on break, Katie says. Her voice is level, steady, the voice of someone who's made a choice and accepted the consequences. If anyone asks, you didn't see me do this. You saw the resident come in at 10:42 p.m. and perform the procedure independently. Understood? Tyler nods. Katie turns and walks out of room 347, pulling the door quietly closed behind her. She knows that the moment she walks away from this bedside, the clock starts counting down. Somewhere in the night, someone will check Tyler's monitor. Someone will see the needle catheter. Someone will ask questions. And when the answers lead back to Katie Rodriguez, everything she's built in the shadows of Cedar Creek Medical will come apart. But for now, in this moment, a child is breathing. She makes it exactly as far as the medication cart before her phone vibrates. A text from an unknown number. The words are brief. Room 347 monitors show intervention. Dr. Mercer has been notified. Report to administration immediately. She stares at the phone. The machinery of consequence is already in motion. She's known it would be. From the moment she decided to act, she's known there would be no turning back. No redemption. No quiet fade into obscurity. She takes a breath. Then she walks toward the elevator, toward Dr. Mercer, toward whatever comes next. The woman who pushes the medication cart at Cedar Creek Medical is about to stop existing. The woman underneath has other plans. The needle went in at 10:06 p.m. Katie didn't announce herself. She didn't call for backup or wait for permission. She moved into room 347 with the kind of quiet purpose that comes from having done this before in a field hospital at FOB Rhino while mortar rounds shook the corrugated metal walls and men screamed in languages she didn't speak but understood perfectly. Pain is data. Blood is information. A child gasping for air is a child who needs a needle between the ribs in the next 90 seconds or he stops gasping altogether. Tyler Hayes lay blue-lipped and panicked, his oxygen saturation plummeting on the monitor. 68, 65. Subcutaneous emphysema crept across his chest like a living thing, air trapped in the tissue spaces between skin and muscle, the signature of a lung that had collapsed inward. The attending physician stood frozen at the foot of the bed, phone already in his hand but no orders coming out of his mouth. 5 doctors had already seen Tyler. 5 specialists had already written their recommendations, comfort care only. Palliative measures. Let nature take its course. Katie had seen this look before. It was the look of a man watching something die and calling it acceptance. She moved past him without a word. Her hands didn't tremble. Her jaw didn't clench. She was already reaching for the 14-gauge angiocath needle from the crash cart, already prepping the site, second intercostal space, mid-clavicular line, the textbook anatomy that every field medic learns and muscle memory never forgets. The room's fluorescent lights hummed overhead like insects. Somewhere down the hall, a monitor beeped its steady rhythm. Someone was alive out there. Tyler wasn't going to join the dead. Not on her watch. The needle slid through skin and muscle. The moment before breakthrough, that suspended second of resistance, and then the hiss of air escaping. Pressurized air that had been slowly crushing the boy's lung, stealing his oxygen, killing him in the kind of slow-motion way that looks like he's just resting. Katie secured the catheter with practiced efficiency, barely 4 seconds of elapsed time from insertion to securing tape. Tyler's oxygen saturation began climbing immediately. 69, 74, 82. Color returned to his lips like someone was turning up the saturation dial on a photograph. His breathing eased. His eyes, which had been wide with that particular terror of suffocation, began to focus. His pupils tracked. His hand, which had been clawing at the sheets, relaxed. The attending physician stared. Then he moved, finally, reaching for the phone with the automatic response of someone who'd been trained to follow protocols even when those protocols were proving themselves spectacularly wrong. Code team to 347, he said into the receiver. His voice sounded distant, like he was speaking from underwater. Actually, stand down. We're stabilizing. The patient is, he paused, watching the monitor. The nurse just performed a needle decompression and the patient is responding. Katie was already running a second full line with the fluid precision of someone whose hands had threaded catheters into arms while sitting in the back of a Blackhawk with rotor wash shaking the walls. The needle slid home. Blood return confirmed. She secured it without commentary. Your good work, the attending said quietly. There was something in his voice like awe. Like he'd been holding his breath for 3 days and had finally remembered how to exhale. Katie didn't acknowledge him. She was already documenting in her head vital signs, procedure type, exact time, patient response. The things they'd teach you in nursing school if nursing school taught the things that actually mattered instead of teaching you how to walk quietly so you didn't bother the doctors. That was when Dr. Mercer walked through the door. He was still in his dinner jacket from the hospital fundraiser, $800 wool blend, monogrammed cuffs visible beneath the sleeves. There was champagne residue on the lapel. He'd come straight from smiling at donors and accepting their money and telling them stories about Cedar Creek Medical's world-class care. He hadn't come from a field hospital in the Hindu Kush where supplies ran out on day 3 and you had to choose which patients got sedation and which ones got to scream through surgery. He'd come from a fundraiser. He'd come from comfort. His eyes landed on Katie first, then on the catheter securing tape on Tyler's chest, then on the monitor displaying oxygen saturation climbing steadily toward 94%. "What the hell have you done?" Katie's hands didn't stop moving. She was already checking the site for bleeding, for infection risk, for the 1,000 small things that determine whether a procedure saves a life or creates new problems. Only when she was absolutely certain the boy was stable did she look up and meet Dr. Mercer's eyes. Her voice, when she spoke, had dropped an octave. It didn't sound like the voice of the medication cart nurse anymore. It sounded like the voice of someone who'd made decisions that meant the difference between 37 people living and dying. Tension pneumothorax. He was crashing. You performed an invasive procedure without physician orders. Without consultation. Without authorization. Mercer's face was going red now, the color spreading from his neck upward like a thermometer in boiling water. You violated protocol. You violated scope of practice. You're a registered nurse, not a physician. Katie turned back to Tyler, checking the taping one final time. The boy's eyes were tracking her movements, following her with the clarity of someone who'd just been pulled back from the edge. His breathing was steady. His oxygen saturation held at 94. His heart rate, which had been climbing toward 140, was settling down. She reached out and placed 2 fingers against his wrist, not checking his pulse, just acknowledging him. Just letting him know someone was still there. "He'd be dead if I'd waited for you." She said it without anger. Without accusation. Just fact, stated like she was reading a patient's chart aloud. The kind of clinical clarity that comes from having made that calculation 1,000 times before, death if I wait versus intervention if I act. Mercer's phone was already out. He was dialing before Katie had even finished speaking, stepping back into the hallway where the fluorescent lights hummed their constant fluorescent hum. His voice carried through the doorway loud enough for everyone in a 6-room radius to hear. "This is Dr. Mercer. I need security to room 347 immediately. I also need to speak with the board chairman. Now." "Yes, I understand it's late. This is a patient safety issue." "No, I don't have time for the answering service." He was pacing now, his free hand moving in sharp gestures as if the person on the other end could actually see him. A nurse just performed a medical procedure without authorization. Possible credential fraud. Clear pattern of insubordination over the past 72 hours. Katie continued working. She didn't look at him. She didn't acknowledge the words. She drew up the antibiotics that Tyler would need to prevent infection at the catheter site, and administered them through the 4 with movements so practiced they looked like dance. Each action purposeful. Each motion exact. She was the kind of calm that comes from having already survived the worst that could happen. She was the kind of still that comes from standing still while mortar rounds hit. Security arrived in 14 minutes. 2 officers in Cedar Creek Medical uniforms, their faces the neutral expression of people who'd received a report about a nurse overstepping and were here to execute policy without understanding the medical reality underneath it. By midnight, the chief nursing officer had arrived in the hospital, called in from home at 11:06 p.m., with a file in her hands and the kind of apologetic expression that meant the decision had already been made. "Katie, I need your badge and your access credentials." Katie removed her badge. The laminated photo showed a different woman, eyes down, expression neutral, the kind of invisible person hospitals filled with. She placed it on the desk without comment. Her access credentials came next. The wireless badge that opened doors and locked them. The proof that she belonged in the spaces she'd been moving through for 3 years. By 6 a.m., after Dr. Mercer had provided statements to the hospital's external investigator, after he'd emphasized the words rogue nurse and pattern of insubordination and possible credential fraud, the suspension had become permanent. The file said termination for gross insubordination and practicing beyond scope of practice. The words were official. The decision was final. At 7:15 a.m., Katie walked out of Cedar Creek Medical with a security officer 3 steps behind. She carried a cardboard box containing her cracked coffee mug, the one with the Marine Corps emblem, a gift from a soldier she'd patched up in Helmand Province 8 years ago. The dying succulent on her desk, leaves already brown at the edges, the one she'd kept meaning to water and never quite managed. The photograph of her son in dress blues, standing beside his commanding officer, before the IED in the Sanjin Valley had made him someone else entirely. And beneath the photo, folded into a tight triangle of red, white, and blue, the flag from his fallen teammate's funeral, the last proof that some lives had value, that some deaths meant something, that some people mattered more than policy. The rain started at 7:51 a.m. Heavy rain. The kind of rain that sounds like applause on the hospital's metal canopy. Katie stood at the bus stop on Peachtree Street in her soaked scrubs, the cardboard box balanced on her hip, water dripping from her hair onto the faces of people she'd never meet. A BMW drove past at 8:02 a.m., Dr. Mercer in the driver's seat, heading towards Cedar Creek Medical for his morning rounds. The radio was playing something classical. His hands were steady on the wheel. He didn't glance left. He didn't see the woman standing at the bus stop with a box containing a dead plant and a flag and the proof of a life he'd been given the power to bury. He didn't know he was driving past the most dangerous person in Atlanta. 3 days after the termination notice came through, the routine background check arrived like a scheduled delivery. Nobody expected to open a door. Cedar Creek Medical's IT department flagged something during their hospital system integration process, a classified security clearance buried in Katie Rodriguez's personnel file, the kind of clearance that doesn't exist in civilian medical databases. The flag triggered an automated Pentagon inquiry. By 8 a.m. that Friday, 3 separate federal agencies had opened files. By noon, the hospital's CEO was fielding calls from people with titles he couldn't quite pronounce. Dr. Mercer didn't know yet. He was in his office reviewing the discharge summary he'd written for Tyler Hayes, documenting palliative care recommendations and noting the boy's irreversible neurological decline, when security escorted Katie through the main entrance. She wore the same scrubs she'd been wearing when they walked her out. Her badge had been deactivated, her access codes locked, her name deleted from the scheduling system by 6 a.m. Now she was walking back through those doors with a Pentagon liaison in a dress uniform and General Marcus Hayes himself moving beside her like the air pressure had changed. The general's uniform held 5 stars pinned to each shoulder, and the way people moved around him suggested they understood instinctively that he owned the room without ever raising his voice. He was Katie's height, built like someone who still ran 6 miles every morning, and his eye scanned Cedar Creek Medical's corridors the way a commander assesses a battlefield. His son walked on his left side, Tyler, the 12-year-old boy, moving without crutches now, his legs steady beneath him, the paralysis already releasing its grip on muscle and nerve. They took the elevator to the 3rd floor. Nobody stopped them. Nobody asked why a 4-star general and a federal liaison were moving through the hospital. The intercom crackled overhead with the day's routine, Dr. Patterson to pediatrics, Dr. Patterson to pediatrics, and Katie moved through it all without expression, her composure like reinforced concrete, her face a neutral mask that revealed nothing of the 18 hours she'd spent sitting on a bus bench outside the Greyhound terminal, staring at nothing, holding a box with a dead plant and a photograph and a memory folded into a flag. When they reached Tyler's room, the boy was sitting up in bed, his physical therapy chart on the wall showing 6 days of measured improvement. He saw Katie and his voice came out clear, no feeding tube, no ventilator, no systems keeping him stitched together. He whispered her call sign across the silence like he was transmitting coordinates from a distant position, Reaper 6. The general didn't flinch. He'd been briefed by the Pentagon liaison during the drive to Cedar Creek Medical. His commanding officer in the Hindu Kush had been Captain Rodriguez, the woman standing in his son's hospital room now, the woman who'd held a field hospital under enemy fire for 14 hours while medevacs coordinated and casualties cycled through her hands and the sounds of mortars echoed against the mountains. His son's commanding officer. His son's living connection to a classified operation that officially never happened, to a mission that had cost 3 lives and saved 47, to a woman who'd chosen nursing because she'd seen what happened when there was nobody there to hold the broken pieces together. "I wanted you to know," the general said, his voice like steady artillery, "that my son will testify, if needed, about your clinical judgment that night. He remembers everything." Pulse check. O2 sat reading. The moment the needle went in, he paused. "My son remembers you." Katie nodded once. That was all. The hospital's conference room filled by 2 p.m. General Hayes sat at the table's head. A Marine colonel in service dress stood beside him, a thin folder in his hands. The hospital CEO occupied the chair that suddenly felt very small. Dr. Mercer sat 3 seats away, his attorney beside him, his confidence visibly fracturing as the general began speaking. The CEO had already authorized an internal investigation. The State Medical Board had already received the Pentagon's concurrent filing. Now a Marine colonel opened that folder, and his voice moved through the first 3 lines of Katie's Silver Star citation with the formal precision of a man reading official history. For gallantry in action against an armed enemy, in Logar Province, Hindu Kush region, on September 12 through 13, 2015. Captain Catherine Rodriguez established and maintained a field surgical treatment facility under sustained enemy fire for 14 continuous hours, during which she triaged 47 combat casualties, performed emergency stabilization procedures on 19 critical patients, and coordinated medical evacuation under conditions that would have justified abandoning the position. Dr. Mercer stood up. His face had gone the color of old bone. His voice came out rough, fractured at the edges. "This is a circus. This is completely inappropriate. I will not sit here while my professional judgment is compromised by—" "Sit down, Doctor," the general said. Not loud. Just a command, the way a 4-star general says things. Mercer Saturday. The conference room door opened. Chen, the IT specialist, a Navy veteran with 15 years of information security experience, walked in carrying a hard drive like it was a weapon. He didn't sit. He stood beside the table and spoke directly to the State Medical Board representative who'd been brought into the room via secure video conference. This drive contains all security footage from the 3rd floor corridor, ICU entrance, and medication station, from 10:15 p.m. through 6:06 a.m. on the night in question, Chen said. His voice had the same flat precision as the Marine colonel's. It shows Captain Rodriguez's needle decompression procedure at 10:41 p.m. Correct technique. Appropriate insertion point. Patient response, immediate respiratory improvement, O2 saturation climbing from 62 to 91% within 90 seconds. Sinus rhythm maintained throughout. The intervention was successful. He paused. The silence pressed against the walls like atmospheric pressure. The drive also contains 17 minutes of audio-video footage from the hallway outside this office at 11:04 p.m., when Dr. Mercer made 4 phone calls coordinating Captain Rodriguez's termination, including explicit instructions to document insubordination in her file regardless of actual clinical outcomes, and requests for the hospital to pursue legal action to prevent her from ever working in emergency medicine again. Chen's eyes didn't move from the State Board representative's face. Dr. Mercer then attempted to delete all footage from this drive. My department recovered the deletion. I've also filed a separate report with the hospital's ethics committee documenting the deletion attempt as potential evidence destruction. The attorney beside Mercer stood up. His face had gone gray. He whispered something to his client. Mercer's hands were shaking now, not the controlled tremor of a surgeon concentrating on delicate work, but the uncontrolled shaking of a man watching his career collapse in real time, in a room full of witnesses, with federal agencies present. The investigation moved fast after that. 3 residents came forward describing Mercer's instructions to document Katie's alleged insubordination. The nursing staff, no longer afraid, no longer worried about retribution, provided statements about his pattern of demeaning behavior, the whisper campaign he'd orchestrated, the way he'd systematically undermined her credibility. The 5 specialists who declared Tyler Hayes hopeless were interviewed. 2 admitted they'd defer to Mercer's judgment without independent examination. One acknowledged that tension pneumothorax had never been ruled out, they'd simply accepted his assessment. The state medical board discovered 2 prior complaints against Mercer that hospital administration had quietly settled. Both involved nurses. Both involved patient care decisions where he'd been wrong. Tyler Hayes began physical therapy. The paralysis wasn't permanent, it was inflammation and edema that 5 doctors had missed and one captain recognized at 10:33 p.m. in the darkness of the ICU. By week 3 of the investigation, Mercer's medical license was suspended. By week 8, it was revoked. His attorney negotiated to avoid criminal charges for evidence destruction, but there was no negotiating away from the end of his career. 6 months later, Katie Rodriguez stood in her new office on the 4th floor of Cedar Creek Medical. The nameplate on the door read Director of Emergency Medicine. The walls held her silver star in a frame, Tyler's first physical therapy progress chart, and a photograph of her son in dress uniform, his 75th Ranger Regiment scroll visible on the desk beside it. The cardboard box she'd carried out in the rain had been transformed into something new. The cracked coffee mug now held pens, the succulent was thriving under the window's light, and the folded flag remained, kept, preserved, honored. She was reviewing trauma protocols when one of the new residents, bright, confident, fresh from a top surgical program, questioned why they needed to listen to nursing assessments during trauma activations. Katie stopped mid-sentence. The room went silent. She walked over to the resident, and her voice came out ice-calm, with the weight of someone who'd held lives together in the dark. The quietest person in the room might be holding it all together. Dismiss them at your peril. The resident swallowed and nodded. That evening, as Katie was finishing her shift, Chen appeared in her doorway. His expression was neutral, but his eyes held something like satisfaction. Medical supply van just pulled into the loading dock, he said. Delivering bedpans and gauze to pediatrics. Katie didn't ask who was driving it. She didn't walk to the window to watch it leave. She returned to her protocols, to the work of rebuilding a department that had failed its people, to the slow, quiet business of healing that she'd been doing all along, even when nobody knew her name. Outside her window, tires on asphalt. A van pulling away into the Atlanta evening. Dr. Mercer driving, alone, delivering supplies to rural clinics that once sought his consultations, that now received his work without his voice, without his authority, without the power he'd spent so long wielding over everyone below him. Katie Rodriguez, Captain Rodriguez, kept working. That was what warriors did. They kept working. They kept building. They kept showing up for the people who needed them, with or without a title, with or without recognition, with only the quiet knowledge that they were strong and the work was good and the people around them were better off because she was there. If you made it this far, you know that the quietest person in the room is often the one holding it all together. Subscribe for more stories of hidden strength and quiet heroism. Like this video if you believe in second chances and career reckoning. Comment below, have you ever been underestimated by someone who didn't know your real value?